I call myself a trusted alumni now. I've moved on to a new role, but Sarah and I work very closely together, and we're excited to talk to you today about kind of the disruptions in our profession. And there's a lot of stuff going on that nurses are dealing with, from staffing to COVID to hospital systems changing to technology, and we're in this state of chaos at the moment. And what's exciting about that, and especially for those of you who have attended this conference, is, we're all innovators, and this is a chance for us to create the future profession that we want to work in. And so hopefully today I'm able to kind of give you some provocation about why industries change and why our profession needs to change. And then Sarah's going to come in and talk about some of the specific things we're seeing in the workforce. Now, both Sarah and I worked at Trusted Health. And, we got to see across 5,000 facilities, thousands and thousands of nurses working in all 50 states. And we saw lots of trends, lots of things that we can learn about how our profession can move forward. And we hope to bring that to you today. So it's always good to start an early Saturday morning with a reflection. And I think this one is really, it kind of sets the tone for where we're at as an industry and as a profession. And so when I read this, think about healthcare as the context. So the dogmas of the quiet past are inadequate to the stormy present. The occasion is piled high with difficulty, and we must rise with the occasion. As our case is new, so we must think anew and act anew. We must disenthrall ourselves, and then we shall save our country. And I think there's a couple pieces in this that we really need to focus on. The first one is we're in a stormy present, and the solutions of the past are no longer relevant. The occasion is piled high with difficulty, and we don't need to rise to the occasion. We need to rise with it, evolve with this change. And then our case is new. And so we have to think differently. We have to disenthrall ourselves from the systems of the past, the traditions of the past that may have been holding us back into building the future profession that we would like to be as nurses. And so in all of this, there's a lot of kind of craziness going on, right? And it's really complex, really complex. So there's technology, there's innovation, there's changes every day. We have no idea where things are coming from or where things are going at any given moment. But there's a concept within design thinking that's called design principles. And design principles distill chaos down into very tangible North Stars that we can follow. And if we can just distill kind of the craziness into these three design principles, then it helps us make sense of all the things and all the pieces and what direction we're going. So these are the three design principles that I think healthcare is heading towards in the next 3 to 5 years. First, everyday life is the new context of care. Second, integrated care teams are linked to people, not places. And third, personalized health experiences are enabled with technology. Now, we're well on our way to most of these North Stars. But if we think about every single day, every decision we have to make, every role we take, every impact we work on, if we put these in mind and we work towards these North Stars, then we're headed in the right direction, and all that chaos kind of falls to the wayside. So let's go to the case for innovation. So, there's a lot of talk today around innovation and technology and change, and we have to evolve. And there's just a lot of buzz around that. In fact, just in Boston a couple days ago was the health conference, or the HLTH conference, where there's buzz around all kinds of new things entering the healthcare market. But we have to take a step back and really fundamentally understand why industries change. Why does innovation occur within systems? And if we do that, then we can understand the drivers that are forcing us to evolve over time and potentially be more coordinated about how we go about it. So there's really three big buckets that force markets to change in innovation. And this is kind of out of the evidence from business schools and other industries outside of healthcare, and how and why they shifted over time. So the first big bucket is there's fractures on the fault line, which means there's cracks in the system that are already getting wider, whether that's because of time or because of events and issues and politics that have happened. Those cracks continue to get bigger. The second big bucket is unthinkable events, and we're all in the middle of one. And those unthinkable events really shift the priorities for a lot of people and organizations, which force people to innovate. And then the last one is running out of road, which means the product or service that is being provided is no longer meeting the needs of the population that's buying it or demanding it. And so the industry has to innovate in order to stay relevant, or it goes away. And nursing is kind of positioned in all three of these. So let's go through them in a little bit more detail. The first one is fractures in the fault line. So again, remember, Sarah and I are watching thousands of nurses across all 50 states, thousands of healthcare facilities. We saw lots of trends: ambulatory, inpatient, long-term care. All of these issues we're going to talk about kind of impacted all of them. So the number one issue that we have, and you're all experiencing, I'm sure, is that healthcare sucks at forecasting its supply and demand of clinical talent. And so we're really good at demand. We know how many jobs are out there. We have no idea where the nurses are and how to engage with them, or what their desire is, what their career path is. And so that creates a big mismatch. So instead of being able to intelligently recruit and grab and retain nursing talent, we throw money out there. And you've seen that with, tons of travel nurse jobs and bill rates and all kinds of stuff. But there's a better way to do that, to engage clinicians more around their professional goals and career trajectory than throwing a bunch of money, which eventually is not sustainable to the system. The second one is really dysfunction in assessment. And so we saw nurses, in New York, they wanted, at the beginning of COVID, 10,000 nurses on the ground immediately. We sent hundreds of them on planes overnight. They still had to do 40 hours of modules, all kinds of HIPAA, tests and prophecy exams, and all these things that they had to do that just don't add value or assess that clinician's competence to provide care that day. And it delays the ability to get clinical talent quickly to where it's needed across the country. And most of these assessments don't work. My good friend, Dr. Rain Soriano, is on here. I'm sure he'll talk about the education side of things during his presentation as well. But we can do better. We can do better about assessing our clinical talent and actually speeding people through these arbitrary orientations to get them on the ground faster. New grads still can't find jobs. Everyone's shouting for a shortage, yet only about 87% of new grads are getting jobs within 1 year of graduation. That should be 100 or 110%. You should be offering jobs to nursing students that have just entered nursing school. If we have a shortage, we shouldn't be waiting and denying practice to some. And there's just been this need for specialists over generalists, especially in COVID. ER and ICU were top of demand, but we're also seeing a bigger demand for level 4 NICU nurses and quaternary trained OR nurses. And so this idea that we graduate med-surg nurses as kind of the core of our nursing school programs is no longer relevant. We have to be thinking about how do we specialize, whether that's big buckets like ambulatory care and inpatient care and long-term care, or if that's even smaller buckets like children's ICU or critical care and ambulatory care. So there's things that we need to think about how we graduate our profession to build this pipeline. The next big bucket is unthinkable events, and we all can name the COVID unthinkable event that's still occurring around us. But for innovation leaders, for people that want to change the system, this is the most exciting time for us, because all of that red tape, all of that bureaucracy, all of that hierarchy gets destroyed when there's unthinkable events. And what that does is it forces people to adapt despite the past restrictions or fear of change or whatever. If you think about your organization, how fast were you able to stand up a COVID unit? How fast were you able to figure out, and whether it was the right way to do it or not, adapt your PPE practices so that you could at least stay somewhat safe? How fast did the people that resisted change for so long start to change because there was no other choice? There's such an opportunity within a crisis for innovators to step up and build the future that we need to really rethink the crisis and think of it as the opportunity for nursing to move forward. And then the last bucket is running out of road. And so, this is just, some red flags that have popped up around our profession that we need to be aware of, that show that our product, the nurses coming out of nursing school and the services we provide are starting to become less relevant over time because we're not adapting fast enough with the changing market of healthcare. The first one is that we need 175,000 nurses every single year through 2029. We only graduate about 150,000 nurses in this country every year. We already have 25,000 down just by our graduation rates, not to mention the early retirements and the other factors that are going into the changing workforce. We need to figure that out, because over time, health systems are going to stop asking looking for nurses to fill the nursing shortage, because if they're not out there, they can't run at 50% capacity forever. And so we're going to start seeing different care models come out, different care teams, different scopes of practice, unless we can figure out the nursing shortage. The second piece is it takes a year for us to orient a new nurse in order to get them productive and ready to run by themselves on a unit competently. If you bought an iPhone and it took you a year to turn it on, you'd stop buying iPhones. Again, we have a mismatch between what we're producing out of nursing schools and what health systems actually need in real time. And so that gap is going to continue to widen unless we start thinking about how we shift towards a future. And then the last big piece is around our scope of practice. In California specifically, where I am and Trusted is based, every profession has some sort of bill in front of the legislature in order to expand their scope of practice, except for nursing. And so pharmacists, paramedics, respiratory therapy, physical therapy, all have bills ready to go to change their scope of practice and increase it, and nursing does not. And so there's a huge opportunity for us to rethink our scope of practice, what our role is, and how we interact with the healthcare system as things evolve. And if we don't do any of that, we're going to continue to see what we're seeing right now, which is burnout, turnover, failed onboardings, workarounds, increased costs to the system, wasted time for the clinician and for the health systems, organizational stress, and eventually this will lead to toxic teams. And it won't be a healing environment for us to work in anymore. It will be a chaotic environment that we're not going to be able to move forward. So what's really exciting about this is we're in chaos, right? And so chaos is exactly the place that an innovator wants to be, because if you think of chaos from a complex systems standpoint, and I love complexity theory, complex adaptive systems, chaos just means that the future is unpredictable. It is the perfect place for a leader to be, because leaders solve problems that are unpredictable. And so we need to think of the chaos around us as energy for change. You can hear it in people's voices. They may not have the answer, but they're stressed. They know the system's broken. They can, in 30 seconds, rattle off 100 ways that their work and their healthcare system is broken and inefficient. That is the energy that catalyzes paradigm shifting change within systems. And it just takes one person or one group to be able to listen, hear it, and translate it into solutioning. And so being in chaos is exactly where you want to be. And so this is the sign you've been looking for. And what's really exciting is constraints breed innovation. And so for us, we should be thinking about not this blue sky thinking where everything's possible. That rarely works. We have to understand the constraints that are pushing our system and build innovation within that so that it's relevant to the workers that are doing the frontline work, whether that's resource constraints or money constraints or time constraints or scope of practice restraints. All of those is a container to harness the energy. When you have blue sky thinking and no constraints, people throw up a bunch of post-it notes on a wall, you take a picture of it, and magically that goes into some email somewhere never to be found again. But when you have constraints driving innovation, you can focus and actually deliver on things much, much faster and quicker. Okay, so let's quickly look at a few things here on what successful innovation is and maybe what unsuccessful innovation is. So the first thing is that Nokia is a successful innovator. I don't know how many of you know Nokia made toilet paper at one point. They were a paper company. And as the office evolved, their job was to connect people in the office. As the office evolved from paper to digital, they changed their business product to evolve with that change in how business was done, from a paper company to a telephone and telecommunication company, always keeping their mission focused on connecting people. And I think a lot of times in healthcare, we think about, oh, well, we can't evolve nursing, because that we'll lose the essence of touching people or the care that we deliver or holding that person's hand. but we have to rethink what nursing is in the future. It's not to say that we won't touch people, but maybe it's enhanced differently through technology. We don't want to be the toilet paper company that's working in the digital age. We want to be evolving our practice as the industry evolves. And sometimes I think nursing is very slow at that. And what we don't want to do is be the blockbuster. And so what Blockbuster did is they doubled down on the past. And nursing is very possibly doing this at the moment. If we double down on the past, we will go the way of Blockbuster very quickly. And not to say we shouldn't respect the past, but what Blockbuster did is they most of their revenue came in from late fees, which is the worst part of their system. They thought brick and mortar was the way to move forward, and then they weren't willing to partner or think about the technologies that were disrupting their industry. And in comes Netflix. Netflix offers to partner with Blockbuster. They turn them down. Netflix starts investing in the technology of the future, Blu-ray and other things. And eventually we know how the story ends, that Blockbuster wins. I'm sorry, Netflix wins. And Blockbuster goes away. There's one left in Bend, Oregon. And then not only did Netflix beat Blockbuster, then they made a documentary about how bad Blockbuster was. And now 700 million people on Netflix can watch it. We don't want nursing to end up like that. We don't want the physical therapy to be making a documentary about how they made nursing irrelevant. Okay. Not that I love physical therapy. My brother's a physical therapist. I just picked that one, but we could have a very real possibility that if we don't evolve, we could go the way of the Blockbuster. We have a ton of culture clashes that Sarah is going to talk about a little bit more, but we have, lack of technology adoption in health systems. We're training people with Post-it boards and annual education days instead of embedding VR as part of their training every single day. We have a workforce that wants to be more flexible and isn't tied to brand loyalty and pension, but is really looking to add value to the system and willing to walk when it's not there. We have all these kinds of culture clashes that are ripe for someone to come in and solution and build innovation. So let's move to a couple of the disruption sources really quickly, and then I want to turn it over to Sarah to talk about the changing workforce. So we have three big disruption sources in nursing and healthcare at the moment: education, workforce, and technology. So let's go through each one of these. First, education is changing. We still have schools that are recreating PowerPoints that they've recreated a million times. The fact that we have schools teaching, the anatomy of the heart, and another school across the street teaching anatomy of the heart using two different complete lectures and two independent faculty members is ridiculous. You can go on osmosis.org right now and basically go to medical or nursing school for $400, get all the content, have it linked directly to some syllabus, and have it taught better than you sitting in a lecture hall somewhere else. We have so many opportunities to enhance how education is done. There's a company called Bundle of Rays, which is in Australia, that's doing VR related training for nursing. We have team-based models where we don't have to do lecture anymore because it's not efficient. And there's new models of how we can learn. We just can rethink how we educate nurses. And most of this content is free. You can get this stuff to repurpose for whatever you need. We also have a changing workforce, and I'm not going to harp on this too much, but you'll never, ever be fully staffed ever again. It's just not going to happen. You're not going to have enough full-time employees in your system or your clinic to be able to staff anymore. You have to think about a more flexible workforce. And that may be nurses doing quote unquote gig roles where they come in and out of systems more fluidly. There's going to be a subset that want full-time employment. There's others that are going to be floating around or traveling or per dieming or whatever they are doing. And that flexible pool of talent is going to need to be harnessed much more efficiently to provide care, instead of trying to recruit and retain all the nurses we could possibly need within a system. They don't exist. There are not enough nurses. And then technology is changing, and nursing's been slow to adopt technology, but machine learning, AI, massive data sets that provide insights, we have to understand how to incorporate that stuff into our clinical decision making, or we're going to be we're already headed towards the route of the dodo. So what's exciting here is it's disruption. There's tons of it. There's so much opportunity for us to change our profession, change the industry, and change population health in general. And so with that, I'm going to throw it over to Sarah to talk a little bit more about what the workforce is doing to change and how we might be able to meet the needs of the nurses that are entering now. Sarah, take it away.
Thanks, Dan. Hello, everyone. I'm gonna pull on a couple threads that Dan has touched on, specifically with the focus on the healthcare workforce and even more specifically the nursing workforce. And so I joined Trusted Health as the founding clinician just over 4 years ago with the passion and the vision to fundamentally change the nursing workforce and how we work and manage our careers, which was quite ambitious. But over the last 4 years, I've, like Dan said, we've had the opportunity to see across thousands of nurses across 50 states working in a lot of different ways. And that has given us an opportunity to really have a deeper understanding of how our workforce is changing. And so the healthcare workforce has changed. But these changes aren't, and these changes aren't unique to healthcare or nursing, but they've created complexities due to the unique nature of healthcare. So now within the nursing workforce, we have 4 generations working side by side, and the nursing workforce looks different. It looks a lot different than it has in the past. And the title of this keynote presentation, or part of it, is the nursing workforce of the future. But this is the nursing workforce of today, and will continue to evolve. But the nursing workforce of today and the future have different values, expectations for how they work, how they're engaged, how they grow their careers. And I think a big piece that we often is not part of the conversation, but is how all of that is a part of their overall lives. So Dan, if you can go to the next slide. So we've talked a lot about how the healthcare workforce has changed, but healthcare employers and those who employ this workforce and the environments in which they work in have not adapted to accommodate these shifts. And so scheduling is still majority seniority based. It's done incrementally, which requires nurses to live and plan their lives also incrementally. So they're always beholden to the next schedule, not able to plan their lives more than 4 to 6 weeks in advance. My favorite example here is at a hospital that I worked at, we had a binder, which was our vacation binder. And once a year, that vacation binder opened to put in your vacation for the year. And that was done seniority based. And you had to physically be there to put in your vacation time. And that's just not the way this profession, this workforce wants and needs to live. While we can manage nearly every other aspect of our lives on our phones, not just on our phones, but within mobile apps, our work is not only computer-based, but it's typically done on legacy systems that don't give much thought to UI, the user interface or user experience. And so while the technology often does what it needs to do, it doesn't take into account who's using it and how they're using it, or even where they're using it. Seniority and tenure continues to be rewarded in ways that really perpetuate a culture that needs to change. We all are very familiar with the phrase like old eating their young, and this really just prevents newer nurses or newer in both experience, but new to facilities or healthcare systems, as we are seeing mobility be a continuing trend in nursing, but they're not receiving proper support to be set up for success, to be doing their job, but also to sustain their careers. And then it really hinders interdisciplinary collaboration, which is absolutely necessary to optimize for patient outcomes. And then due to the nature of scheduling and overstaffed units, there's really little opportunity for the nursing workforce to build camaraderie and for there to be true team building that is so core to those patient outcomes that I refer to. And then opportunity. Growth is linear within our profession. Often it relies on antiquated clinical ladders, which are not universal or translate across health systems or care settings, and really emphasizes tenure or years of experience. And so it's just that part of healthcare is absolutely not changed for what I'll talk about next, which is the values and the priorities of our changing workforce. And then resources. Dan talked about this. I don't think we need to harp on this, but healthcare continues to expect the same things from a workforce that has not only changed, but continues to not be properly resourced or set up for success to do the work that they are incredibly passionate about. Dan, if you can go to the next slide. So the values and the priorities of the nursing workforce of today and of the future. They want flexibility, they want variety, they want control. Whether that's flexibility to work in different ways, work across different care settings, across different specialties. Dan threw the word out there, on demand. They want to work when they want and where they want, and that needs to be a reality if we are going to grow and retain a healthy nursing workforce. They feel stuck. They're not wanting to pursue the traditional paths of leadership or continued education, yet they're still seeking challenge and exposure and opportunities to gain new skills. Going to deviate here a little bit with a personal story. So I say they a lot, but this is me, and this was me. And so a couple of years into my nursing career, I always thought, I'm going to go back. I'll get an advanced degree, and that's the direction my nursing career is going to go in. And after a handful of years at the bedside, I didn't find that was what I was drawn to. But I kept remembering, as I had when I had chose nursing school, was, there's so many opportunities within nursing. There's so many things that you can do. Yet I sat there wondering, like, what are those and where are they and how do I connect them? And I found myself also entirely accountable for figuring out what career growth looked like for me. And so that's ultimately how I ended up taking a pretty big career change and working in tech for a healthcare startup. But over the years, as I've interacted with thousands of nurses, have found that they are feeling a lot of those same things. They want challenge. They are feeling stagnation. They are feeling boredom, but they're not sure what career growth looks like for them. And I'll touch on this next, but unfortunately, what that is looking like is departure from the profession. And so we need to find ways for nurses to find growth in what that looks like for them, not how healthcare and the profession has historically been designed. And they prioritize balance. And so, that's really not wanting to have to compromise other important aspects of their lives for their careers. And while their careers are incredibly important to them, they're not the center of their lives. And, they want to be able to, going back to that scheduling example, they want to be able to attend the important events in their lives without 100% of the onus being on them to find a switch because they don't have the proper tenure or seniority to have gotten, that Saturday off to attend their best friend's bridal shower. And that's just a really specific example, but for the modern nursing workforce, they need to be able to have the control and the flexibility to prioritize other aspects of their lives in order to sustain more than just a handful of years within the profession. And then there's an expectation of transparency. We in addition to, everything being digital, we can manage almost every other aspect of our lives via our phone, via a mobile app. We have unlimited access to information, self-service. We don't have to rely on humans to do a lot of what we want to do. You can book vacations, you can order food, you can anything you want to do with a couple touches of a button. And nurses expect aspects of that within their career as well. And so, that's modern tools and technology, like Dan said, that's VR, that's not having to work through the cumbersome tools and technologies that exist in order to simply provide the care, that they are qualified to be providing. And so, Dan, if you can go to the next slide. These values and priorities manifest in different ways, whether it's different roles, frequencies, pathways. But the reality is that nurses don't want to go and work on a unit for 20 years anymore, much less 5. They want that variety, that flexibility, that control, all of these things that manifest in what is currently available. But, as we think about innovation opportunities here and kind of this period of chaos that we are in, is there are so many other ways to think about, like, how do we want this to manifest? But how this manifests today, so travel nursing. You know, especially in the last year and a half, and as we've seen pretty like astronomical rates for nurses to go work in different areas of the country, nurses aren't just attracted to travel nursing for the compensation. It offers the variety, it offers the flexibility, the like a balance, control, non-traditional growth that staff nursing that they're not often getting from their roles as a staff nurse. And so, you know, that means being able to work 13 weeks potentially at a time so that they can guarantee time off to prioritize those other aspects of their lives. Per diem, you know, per diem is often, you know, understood as the most flexible way to work, but more and more nurses are wanting to work per diem, not because they're wanting to work less, but because they're wanting to work with more control over their schedules and their lives. And so we're seeing more and more nurses stitching together various per diem opportunities to essentially be working full time, but to gain that control. Switching specialties, you know, nurses want variety, and that variety doesn't, you know, I mentioned this to someone and they say, well, you know, but my nurses always complain when I have to float them to other units. That's different. You know, that's showing up and having to, you know, provide care in a different place and with a different team than you were anticipating that morning or that night. But switching specialties to prevent that stagnation, that boredom, but also to seek that challenge. And oftentimes with travel nursing, travel nurses are often floated first. And so travel nurses often get that cross specialty experience a bit more naturally. And so how can we think about being more intentional about getting staff nurses more exposure across specialties without letting them know, you know, 10 minutes before they need to be ready to go that they're going to another unit that day. Switching care settings is often something we see and hear from nurses who are looking for a different pace and just a variety in a different pace, but also to explore potentially what could be next for them. And so, you know, we're seeing ICU nurses wanting to work in ambulatory care settings or in clinics, just simply for a different pace because they're so burnt out, and they're trying to find ways to sustain the profession for them, sustain their careers without completely abandoning it. And oftentimes different scheduling. So, you know, traditionally acute and critical care nurses are working nights and weekends, and often nurses are looking to switch care settings even briefly to, you know, to work that Monday through Friday or Monday through Thursday to be able to prioritize the other aspects of their lives on weekends and nights, and to be able to spend holidays with their families. And then non-nursing degrees. I was almost guilty of this, and that when I was looking for what was next in my career, and I knew that the traditional linear career path within nursing that was presented to me was not something that I wanted to pursue. And I found myself incredibly passionate about fundamentally changing the way nurses work and solving a lot of the inefficiencies in care delivery. How does one do that? And so I was on my way to getting my MBA when I found Trusted. But more and more nurses are wanting to diversify their knowledge and figure out how can they leverage their clinical experience, but also gain other skills and knowledge, specifically business and technical knowledge and skills, to be able to pursue alternate career paths. And so these are all of the different ways that these values and priorities are manifesting today. But you know, that's where there's a future of opportunity, and how we can all look at our own health systems and think about what are the different ways that we can meet our nursing workforce where they are today, and really respect and understand their values and priorities, and in order to retain them, and if it's not specifically retaining them within health systems and facilities, keeping them in the profession. And Dan, if you can go to the next slide. So these are just different ways from, you know, everything that we've heard from nurses, surveys, that we can think about adapting. And so that is being visible and available. And this seems really straightforward, but the nursing workforce of today, they want to see their leaders. They want to know that their leaders know them. I think there tends to be, you know, specifically in travel nursing, but this is just I think an exacerbation of what we see. But travel nurses often, as they're finishing up their assignments, need to get references, recent references. And most of the time it's required to be from their managers. I can't tell you how many travel nurses have been in and out of facilities for 13 plus weeks at a time and have not only not met their managers, but have never seen them. So the visibility and availability is so important for nurses, but also for them to be able to engage, to have conversations about what growth could look like for them. Creating opportunities across generations, and I think there's a little bit of this through a couple of these bullet points, but don't just rely on your more tenured and experienced nurses to engage them in ideas or to empower them to help to surface and solve challenges. Look across the generations in your workforce, but then also educate your teams on those generational trends. And so a lot of what we're seeing in the culture clashes are simply generations who are working alongside each other. And there's 4 generations within nursing who don't necessarily understand each other or have different values and priorities. And it might just be a matter of acknowledging them and talking about them. And then embracing transparency and supporting innovation. There's incredible, innovation things going on across every health system, but what does that actually mean to frontline staff, to your bedside nurses? And so talking about it, embracing the transparency about what that actually means and what goes into it. Seeking ideas beyond the leadership table. Again, engage your frontline staff. They often have the best ideas. They can not only tell you all of the problems that they face and the inefficiencies in their care delivery, but they have a lot of ideas for how to solve them. And then creating connectedness. We've at Trusted, in addition to connecting travel nurses to flexible opportunities, we have an incredible community of far beyond just travel nurses. And while that's had to go digital over the last year and a half, there's such an opportunity like this, NursesBond, to bring nurses together, because due to the nature of scheduling and the sheer lack of a few minutes even we have on a given shift to connect with our coworkers, we have to find ways to connect nurses outside of simply working together at the bedside. And then being willing to let go. So Dan's talked about this. I'll probably talk about it a little bit more. I love his passion for it. Like, we have to let go of what has worked in the past, because what has worked in the past is not going to work in the future, and things evolve. Everything evolves. Evolution. We wouldn't be here if we hadn't evolved. And so rather than trying to hold on to what has worked in the past, and as an example, I was talking to a nursing leader who said, Sarah, but I'm looking like, how can I retain my nurses? Like, I want them to stay here 5, 10, 15 years. Like, that's worked. And I said, it's not the future. And so as soon as we let that go and start thinking about, okay, how can we meet nurses where they are, and how can we set them up for success for the periods of time that we do have them? We have to just think about retention in a different way. And maybe we should be thinking about retention for the profession versus retention for our units and our facilities. So I'm going to be passing it back over to Dan.
Awesome, Sarah. Thanks for those insights. And if you haven't checked out Sarah, Sarah's an amazing nurse leader, and you need to all follow her on LinkedIn and follow Trusted Health, because they're doing some really cool stuff to support the profession. And so thanks, Sarah. So let's end this this presentation on a couple things. So we've told you about what's broken. We've told you about a couple solutions, but let's kind of talk conceptually about the secrets of the successful. Because I think there's some myth of innovation. Actually, there's a great book called The Myths of Innovation by Scott Birkin too. But there's a myth of innovation that it's some magical thing that happens, and you go from having an idea in the shower to implementing an entire business or product, within a couple months. And it doesn't work like that. And a lot of the innovations that we talked about today, we need to think of building them as the hamster wheel. And so Sarah and I have a colleague, Harier, who leads up one of the technology products that Trusted has. And he loves this concept of a hamster wheel, which means, you may have this awesome technology idea, but behind the scenes, until you can build it, you're hamstering. You have people doing the hamster wheel dance. And so, don't think that everything has to be perfect off the bat. You can use people and manual processes to do things as your innovation evolves over time. I think the second conceptual thing is you have to fix the system, not the feature. And so what this means is that a lot of people want to fix that bug or that one little specific thing. Like if we just changed, move from a binder to a digital platform, like that's going to fix our scheduling, instead of thinking about how we schedule in general. And so think about the system that's broken, not the feature that's broken. If you can zoom out to that, then you're going to have more sustainable change over time. Understand your own risk tolerance. You may not be the one that wants to jump out in front first. There's a whole if you look at Everett Rogers, his diffusion of S-curve, there's everything from the innovator to the laggard. Know where you stand in there, and then that will help you be more comfortable with leading change or being a part of change. And then the last piece, in healthcare is really bad at this, is reassess your priorities frequently. If you have a 5-year strategic plan, you're doing it wrong. And so think about reassessing how fast you change priorities in a world that shifts minute by minute, hour by hour. If you're not at least reevaluating your priorities every quarter, you're probably too slow. And if we do all of these things, we'll eventually move from fragmented efforts to this connected idea of innovation and a connected idea of a nursing profession. And so we are NursesBond. I see that the NursesBond is the bonding agent of nurses. We need to be connected so that we can move forward in our profession and stay relevant and provide the care that we know that is needed by our patients. And finally, it's really just start with one thing, learn one new technology, create one new partnership, worry about one less laggard who's never going to adopt the change, modify one team. Tomorrow, you can do any of this stuff without asking permission. And so in order to move forward, you have to start with one. And so take that leap. And today is one of the great days to do that. And then finally, if you want more resources from Sarah and I, you can go to trustedhealth.com. There's a ton of free stuff there for nurses to help them with their career. You can sign up and manage your portfolio, your professional portfolio online. If you want more innovation content, you can go to drnursedan.com. Again, a lot of free resources and things there as well. So